Hello, friends. Continuing this conversation about adult ADHD. My name is Rakesh Jain. Well, we need to be reminded, right, that ADHD indeed is a 24 hours per day condition, and it is actually quite impairing. We should also remember that ADHD has comorbidities. And if you can look at these overlapping bubbles, you will notice that these comorbidities come in so many different shapes for our adult fellow human beings who have ADHD. Certainly, they have symptoms of moodiness sometimes, anxiety, substance misuse, even bipolar disorder. In fact, if you look at the numbers, 50 to 80% of individuals, adult individuals who have ADHD, have at least one and sometimes more than one comorbidity. And it should also not be missed that the classic symptoms of ADHD, hyperactivity, impulsivity, and inattentiveness, are actually not the full picture. You want to take a look at the full picture? Here it is. Emotional dysregulation, behavioral dysregulation, learning difficulties, psychosocial symptoms, sleep issues. These are all part and parcel of the life of someone who's an adult who suffers from this condition. And this ring of fire, these are various comorbidities that often chase after an adult who has ADHD. And these numbers are horrendous. For example, major depression. The odds ratio, if you have adult ADHD, that you would also have major depression, is increased by 2.7. Substance misuse, 3.0. Drug dependence, 7.9. Bipolar disorder, 7.4. And anxiety disorders, all of them at very high numbers. So it's kind of important not to think of ADHD as a disorder that lives in isolation. It is really important to appreciate that comorbidities are common, and addressing them appropriately is very important if our goal is to help a patient fully and completely. And watch out for these two disorders. In fact, one of the world's largest survey, population-based survey, called the National Comorbidity Survey Replication, found that the risk of having major depression in those who have, for example, adult ADHD is as much as 1 in 5. Bipolar disorder, 1 in 5. Dysthymia, 1 in 10. In any anxiety disorder, almost half the patients. What is a clinician to do with this? Well, perhaps the take-home message might be, if you do diagnose someone with adult ADHD, make sure you look for comorbidities, because your treatment decisions will be heavily influenced by whatever you detect. But the converse is equally true. Should you run into patients with substance misuse, anxiety disorders, depression, or anxiety, make sure that we as clinicians look for adult ADHD in them, because it's actually quite a common occurrence. It's a prevalent disorder. This is why we're having this conversation. It's not just a pediatric disorder, it's a pediatric, adolescent, and adult year disorder, and it can be very impairing. That's one message I simply didn't want to gloss over. It can change human life. It can change human personality. It can radically alter the shape of one's educational career or vocational career. And just so that this point is not missed by us, I wanted to show you this data set from not that long ago that shows that impairment in all of these things, teen pregnancies, substance misuse, arrest, incarceration, being fired from a job, having ADHD dramatically increases the risk of all of these major life impediments. And you can see these troubles all the way from academic failure to relationship failures to legal difficulties to risky sexual behavior, accidents, occupational problems, financial problems, and unhealthy lifestyles. Watch out for adult ADHD. As you can clearly see for yourself, it can be a major source of trouble for our fellow humans who suffer from adult ADHD, and it can be a lethal condition. Yes, I said that. It can be a lethal condition. Those who have adult ADHD, particularly with comorbidities, have much higher rate of dying by either suicide or homicide or accidents, please watch out. It's time to really respect adult ADHD. And one more time reminding you, it's a 24-hour-a-day disorder. Therefore, the treatments we offer really have to keep this in mind. We really want to offer treatments that cover the maximum number of hours in a patient's day in order to offer them maximum help. And with that, I would like to remind you that all facets of an individual's life can be adversely affected by ADHD. It's not just a school-based condition or a work-based condition. It affects nearly everything a human being would touch should they have untreated or undertreated adult ADHD. So, with that, I want to again ask you to keep adult ADHD in mind